All right, good morning, guys. Thanks for turning into another segment on Ferko TV. So this is Wednesday morning. All right, good morning for those that are in here right now. All right, we're going to continue talking about the skeletal system today. You can chat on the sidebar there once you're checking in. We'll wait another minute or so. Looks like I've got one person in here so far. And any other questions you may have about your skeletal system project, due Friday. Looks like I've got a few more people checking in. Good morning. Hope all is well. Okay, we'll wait about another minute here since there's only two people in here right now. If you have any questions, we're going to continue talking. We'll review some things on the skeletal system. Good morning, Chris. Thanks for checking in. Thanks for being here. Any questions that you may have on the skeletal system and the bones? I'm going to kind of go over some of the parts of the bones today in a little bit more detail, and then talk about some of the diseases too. So we'll review a little bit, talk about the bones itself, and then talk about some diseases related to the skeletal system there with the bones. Okay. All right. All right. We'll wait like one more minute maybe, then we'll get started here. So we only got a few people in here at this moment here. Okay. All right. Well, I'm going to get started here anyhow. So, just as a review, Chris, as I know you're in here, or anybody else that wants to help answer, can you tell me a function of bones? What is one function of bones? You can just type it in on the chat bar. What is one function of bones? Well, how do they help us? What is one thing that they do? What function? That's something that they do. What is one function of bones that I covered from the other day, just to see if you were paying attention here? What do they help us do? You can write your answer right in the live chat there. Okay, they help us move. Very good. Movement is one. Very good. Do you have any other ones that you want to help answer there? Very good. Movement is a very important one. They help us move. Any other types of functions of bones? We're talking about functions of bones. If you just checked in right now, what do they do? How do they help us? Other than they help us move, as Chris stated. Anybody else want to add on to that? You can write your answer in the chat bar. Okay, not only do they help us move, they help support our body. They keep us upright. Remember, I was saying if we didn't have bones in our body, we'd probably be like a blob, right? We wouldn't have anything supporting us. So they help us stay upright. They protect our soft organs, like, for example, our heart, our lungs, our liver, those areas within our chest region with our rib cage. It protects those. As Chris mentioned, movement. They help us move as we're running and playing and so on. They store minerals and fats, and they also help for blood cell formation. So those are some important ones. Okay, it looks like we got Alyssa. Thank you for checking in here, Alyssa. So make sure you're keeping the comments about science, not talking to other people in here. Okay. All right. So just to let you know there, Alyssa. All right. I can see what you guys chat there. So make sure you're keeping it on the topic here. If you have any questions on the project and so on. I'm talking about bones right now in the human body. The human skeleton has 206 bones. You have more bones when you're younger. At your age, as you get older, they'll start to fuse together, and then you'll have less amount of bones. There are two types of bone tissues I went over on Monday as well. Those two are called compact bone. Those are the harder outer regions of the bone, and spongy bone, which are the inner regions. They have many open spaces. They have like needle-like pieces between them. Okay, so that is the two types of bone tissue, compact bone and spongy bone. Next, I'm going to go over are the classifications of shape. Does anyone remember from Monday what were some of the shapes here? I got a few more people that checked in. Does anyone remember some of the shapes of the bones? There was 4 specific types of shapes that I went over of the bone. This is a review from Monday. We're going to start off with a little bit of a review, then I'll answer questions that you may have for your project. I'm going to talk about some of the bones itself and some of the diseases related to bone illnesses. All right, so who could tell me what is one shape of the bone? If you remember from Monday, what is one shape? All right. Hi, Sam. Hi. So thanks for checking in. All right, Sam's in here. We got Alyssa. We got Chris. Thanks for checking in, guys. So I'm asking the question right now. What were some of the shapes of bones from Monday? I went over 4 specific shapes of bones. Okay. Sam says the spine. All right, the spine would be considered. That's not. That's a type of bone. Very good. Or vertebrae. That I'm looking for the shape of the spine. Can you maybe help me out with the shape of the spine? What it would be? What kind of shape would you classify that as? Would it be long, short, flat, maybe irregular? What do you think the shape of the spine may be? Okay, that's a good try. Long, you stated. Actually, it's an irregular shape. The spine's kind of irregular shape because it's kind of long and twisty and stuff like that. So it's odd shaped. So that was one of the shapes that would be vertebrae or your pelvis, your hip bone. They're irregular shape. Another bone I mentioned there is a flat bone. Flat bones are usually curved, and they have your skull or your sternum. Your sternum is your midsection between the ribs. There is the bone between the ribs. So that would be considered a flat bone. A short bone are usually bones that are like your wrist or your ankles. Okay, that would be considered a short bone. And then a long bone are bones that are longer than they are wider. Your arms and your legs would be considered long bones. Okay, so like your arms, your humerus, your upper part of the arm, your leg, your femur, the longest bone in your body, those are considered the long bone. Okay, all right, good job. So thanks for participating on that. All right, next I'm going to talk about is the 2 parts of the skeleton. As I mentioned on Monday, there's something called the axial skeleton and the appendicular skeleton. So the axial skeleton includes your skull, your vertebrae column, that's your backbone going down your back, your ribs, and your sternum. Okay? All right, so your sternum's in between. That's considered your axial skeleton. So everything in your midsection, skull, vertebrae column, ribs. Appendicular skeleton is going to be everything else. Your girdle, meaning your pelvic area, okay, your upper pectoral area, okay, your shoulders, okay, your pelvic area, and your limbs, meaning your legs and your arms, your forearm and hind limbs. Okay, so those are known as the appendicular skeleton. So get familiar with knowing the 2 names of those terms there. Okay, now in the body, in the adult body, there are 206 bones. Okay, 206 bones. You guys and children have 213 bones. Like I was saying, as you grow and develop, those bones will start to form and fuse into one another, where you'll have less amount of bones. So it looks like you have about 7 less bones in your body as you grow and develop. So that's kind of interesting fact with the skeletal system. All right, hi Chloe, thank you for checking in here as well too. Make sure you guys are asking questions on the topic here because I can see what you guys chat. So make sure you keep it on the topic here, please, and not with one another. Okay. All right. So continuing on, the bones in the adults, in the human axial skeleton, like I was saying, your skull, your spinal column, and your rib cage, you have 80 bones in that area. Okay. So those include your skull. Believe it or not, you have 29 bones in your skull. Your vertebrae column, your backbone, 26 bones there. Your rib cage, 24 bones in your rib cage, okay, and your sternum. All right, has one bone in the middle. It's like your breastplate, as they call that. Okay. All right. You don't have to know all the bones in the skull, but I'm going to kind of go over a few of them. Well, they talk about the top of the head's called the cranium. The cranium, you have 8 bones there. In your face, your cheeks, and so on, your eyebrow area, you got 14 bones in that area. Auditory or ears, you have 6 bones around your earlobe. Okay, they call the hyoid your jawbone. Okay, and tongue, you have a bone in between, just one bone consists in that area there. Okay, so there, like I was saying, there's 8 bones within the cranium. Okay, the cranial bones join together by what they call an immovable joint called a suture. That's the top there of the cranium. Okay, so that would be that. All right, so I'm just kind of covering some of the bones on here. All right, any questions here? Yeah, that is a lot. So thanks, Sam, for adding in there. There is a lot of bones, more than we thought, within our skull. All right, so continuing on. All right, with the human, the skull and the facial bones. Like I was saying, in the face, there's 14 bones in the face, like you got a couple in the nasal area as well. Okay, your cheekbones, as I was mentioning there, your upper jaw, lower jaw, those areas, the mandible. All right, that's your like your teeth area. There's some bones in there. Okay, from within the human face. All right. Okay, the hyoid, that is known as your jaw. Okay, it's located on the floor of this cavity, so it's kind of like your jawline right there. So that's another bone within there. All right. Now the human vertebrae column, that's your backbone, all right, or spine bone, that's known as the backbone or spine bone, has 33 in the vertebra, but some fuse together, so they total to net about 26 bones. Okay, you don't have to know these numbers. These are just good to know. So I'm giving you some specifics here on the breakdown of the bone here. So your human vertebrae, like I was saying, has 6 in that area. Okay. All right. So or 26, I should say. The coccyx is the very, like your tailbone, the very bottom of it. Okay, the cervical column of vertebrae is the upper part of your neck. So it goes all the way from your neck, all the way down your back to where your tailbone would be. Okay, all right. So that is some of that area for the human vertebra column. Okay, so the human vertebrae column is about 70 centimeters long. Okay, and it's curved, kind of like an S. Okay, how it would form. Okay, it's formation there. All right. All right. Continuing on here. Now the vertebrae column is different, has differentiated 5 regions. They call the upper part the cervical, that's up near your neck. The thoracic is the mid part of it. The lumbars, the lower. The sacral and the caudal are the very bottom. That's kind of like I said, where your tailbone would be. Okay, so that's the human vertebral column. All right. All right. So the neck bone, which is kind of unique here, mammals are characterized by the presence of 7 cervical vertebrae, meaning that we have 7 bones in our neck. So, which is interesting. Humans, rats, rabbits, giraffes, they all have 7 cervical vertebrae, meaning in that area. Okay. All right. So there are a couple other animals that may not have. The exceptions are ones like manatees and sloths. They have 6 in their neck bone there. Okay, which makes it kind of unusual. And some other animals like bears and they have 8 or 9 in their cervical column. So some animal species different from that. Okay, which is unique. All right. All right. So that is your human vertebral column there for the backbone itself. Okay. All right. The next thing I want to talk about is your thoracic area, and that's the mid part. Okay, of your that's just below the neck area. Okay, and the thoracic vertebra, there's 12 in that area, 12 bones in there, and they're differentiated from the front and the back. So the ribs are attached to the thoracic vertebrae. So your ribs are attached to there. So your lumbar vertebrae is just below that, and that's the largest and heaviest part of the vertebral column there. Okay, and the caudal, or the very bottom, like I was saying, above, like where your tailbone would be, is called the coccyx. All right, and that is unique because it's considered into like the tailbone, the very bottom of the bone there. All right, next I'm going to talk about is the rib cage, the human rib cage there. All right, so In the human ribs, there are 12 pairs, okay, of bones. So there are three types. The first seven pair are true ribs. Then the next three are what they call false ribs, and the last two are pairs of floating ribs at the very bottom there. So that's what they how they're characterized. So 12 pairs of ribs in the body there. All right, so the floating ribs protect your kidneys. Okay, those are ones that are kind of a little bit lower where your kidneys may be. All right, and the cervical ribs are not ribs. They are backwardly directly possess the cervical column, especially in species like birds. So they're a little bit different than some other animal species. So the next part of the midsection here, which we're talking about the axial skeleton. So we talked about the cranium. We now talked about the backbone itself. Is the breastbone that is in between the chest here? That's the sternum. We call that. So this supports the thoracic and ventral side. It's about 15 centimeters long. Okay, it consists of a couple parts. The upper part is the uppermost part. There's a middle part and a lower part to the human sternum. Okay. Now, the next part of the skeletal system, remember, like I said, the axial and appendicular. Now, these are your pectoral girdle. The appendicular is your pectoral, like your shoulders and your arms and your legs and your pelvis area. So this is how they're separated when we study the skeletal system here. So you have a total of 126 bones in all the other areas, your arms, your legs, your shoulders, okay, along with your feet and so on. All right, this includes 6 in the girdle, that's your mid area, and limb bones. You got 120 bones around your limbs. Okay, so that is some unique numbers there. So I'm going to talk about some specific parts here. So the pectoral girdle is known as the shoulder blade or shoulder girdle. Okay, and it consists of two bones there. They call that the scapula, which is the back part, your shoulder blade, and the clavicle, which is your collarbone, like right in this area right here. Okay, so those are areas they process parts within that area. So the clavicle is known as the collarbone. They also call that another name as far as the beauty bone. Okay, um, and at the conjunction of the scapula and clavicle is a cup-shaped cavity. All right, so it's head of the humerus and articulates the cavity. So that's where kind of where your humerus, your upper part of your arm, would fit into that shoulder blade there. Okay. All right, so that is the clavicle. All right, your pelvic girdle is known as your hip bone. Okay, and each half of the pelvic girdle is kind of formed where there's another 3 smaller bones, one called the ilium, the ischium, and the pubis. Those are just the names of the bones. You don't have to know those. Those are just some small bones that kind of fit into the hip bone. So just know about the pelvic girdles known as the hip bone, where that will be considered as a joint for where your leg bone will connect to for walking and movement. Okay. All right. So the pelvic girdle are joined by slightly movable joints. Okay. Remember, we call those slightly movable joints. We call those cartilaginous joints. Okay. They were able to. There's cartilage between them to help lubricate that joint to move it. Okay. All right. And that would be around the pelvic girdle. Okay. Any questions so far? Okay, we got Bill, we got Kyle. Thanks for checking in, guys. Okay. All right. All right. Thank you so much. All right. Now I'm going to talk about the limb bones, your forearms. Okay. Or forelimbs. Okay. There's about 60 bones, 120 altogether in your forelimbs. Okay. So I want to talk more about the arm bones right now, the ones that are along your arm. So there's one bone called the humerus. That's the upper bone portion of the arm. It's characterized by the presence of the deltoid ridge for attachment of muscles to there. And then you have two radius. So there's two other bones in your lower forearm called the radius on the outer side and ulna on the inner side. Ulna is the longer outer bone. Okay. All right, I think I had that backwards. Radius, ulna is the longer outer bone. Then the radius is more the inner bone. So both the radius and ulna have nutrient formata in it, so that provides nutrients. Let me realize that helps stores certain fats and minerals. Okay, as well. All right, so that's what the radius and ulna, the old or the is the longer outer bone is the ulna, and the inner bone would be the radius. All right, the next part are your hands. They call that the carpal. And that is, there's 8 bones of the wrist, okay, and they're arranged in a couple rows for that. All right, so that is unique about the wrist itself. Okay. All right, and then we have what they call the metacarpal. The metacarpal are bones of the palm of your hands. Not only your wrist, but the carpal's more your wrist. The metacarpal is your palm. Okay, and they're usually these are long and thin, and then phalanges are bones of your fingers, your finger bones. Okay, so that's what those are called, phalanges. That's the name for those. All right, now I'm going to talk about the leg bones, your hind limbs. Okay, I got 60 bones in this area as well. One meaning the femur, this is the thigh bone is the longest human bone in the body. You have one called the patella, is also known as the kneecap. Okay, and actually the kneecap is absent in newborns. Okay, so but they'll develop as a child gets older there. So they're formed around by other ligaments around there. Then you have another bone called the tibia. That's known as your shin bone. Okay, it is a bone of the shank known as the shin bone. It's the front part of your leg. Now, where your shin bones, where you're playing soccer, they have that shin guards that cover up that bone and protect your shins. Now, the back part of the bone is called the fibula. It's the bone of the shank region. It is the thin and weak bone. It's kind of the one that goes along where your calf would be. Okay. All right, and then we have something called tarsals. Tarsals are bones of the ankle, kind of like carpal. Your wrist is carpal, your ankle are called tarsals. Okay, so tarsals, you have 6 bones along in that area there too. Metacarpals, okay, or metatarsals are bones of your foot. Okay, so those are the feet bones, so like the ones above your toes there on your foot. 14, the next were called phalanges. Same thing. Fingers and toes are the same exact thing. They're called phalanges. Okay. All right. So those are your bones of your feet. Any questions as I covered over some of the specific types of bones here with you guys? Diseases next, then I'll answer or go over anything about the project, okay, on there next. So let me kind of talk about some types of bone diseases and conditions of the skeletal system. First one I'm going to talk about, you probably have heard of this one before, it's called arthritis. Maybe you know somebody in your family that has arthritis. If you have somebody in your family that has arthritis, go ahead and let me know on the chat there, or what you might know about arthritis, so you can have have some live chat interaction between me here about this subject here. There's something called rheumatoid arthritis. It usually affects the joints, both on equal sides, and it may begin initially to a couple of the joints, and it attacks the wrists, the hands, elbows, shoulders, knees, and ankles. And I'll talk about that one. There's another one that's a form of arthritis called rheumatoid arthritis that affects your the movements of these joints. Okay, and I actually have a form of it, and I'll talk about which one I have. I have a form of arthritis myself, and I do take a medication for it too. So I'll share a few things once I get to that one. So usually here people with arthritis, their fingers might look kind of like they're crooked or they're overused. Maybe the rumor is it's a false myth of cracking your knuckles will give you arthritis. That ain't true. I've been cracking my knuckles for years, and I haven't got any type of arthritis in my hands. Okay. Another inflammation or illness of the skeletal system is called bursitis, and it's inflammation of the bursa sac, and it can become inflamed from injury or infection, and it's localized pain or swelling for that one. So that one's usually around your elbows and or your knees there too. That's the bursa sac there. So that can get inflamed. All right. Tendinitis, you might have heard of that one there too. Um, Tendinitis is another illness, or inflammation of the tendon, and it becomes a movement becomes more painful with that, and it's caused by a common cause is overuse. All right, and I just had a case of that this past over the last week. I've been running a lot in the evenings, so I go out and run, on the A1A here, which I don't live very far from the beach, so I run the main road and it goes down. So if you overuse that, you get inflammation of your tendons around your Achilles heel. I would feel a pain around my calf. If I ran too many days in a row without taking a rest, that will start to inflame. So it's a form of tendonitis. So you got to give yourself a rest sometimes between those workouts. So you might have heard of tendonitis before, and that's another illness within the skeletal system. Another one you may have heard about is carpal tunnel syndrome. Anyone hear about carpal tunnel? If you know anything about carpal tunnel, all right. Looks like we got Soraya. Hi, Soraya. Thanks for checking in as well. And Kyle and Val. Thanks for and Sam, Chloe. Anybody else? Chris in here. Alyssa was in here too. So thanks for checking in. If you have any questions, you can ask anytime. But I'm talking about illnesses of the skeletal system right now. So carpal tunnel syndrome is a swelling or change in position of tissue within the carpal tunnels of squeezing that squeezes and irritates the nerve. So causes of tingling and numbness in the thumb, index, or middle finger. Now, over time, people that work on computers for a long period of time or typing, sitting in a specific area or way, texting on the phone, those are going to cause numbness within the thumb and finger. So give your fingers a rest over time. As you guys are young, you're going to be using computers and cell phones over the years. So minimize some of those uses because you might develop carpal tunnel syndrome from that. Okay, and then you'll have to get surgery, and they cut right between your hand, your palm of your hand, and it could be pretty painful surgery. I've known some people have had it done, and they go in and fix the nerves around the tendons of your hand there. Okay. All right, so that is carpal tunnel, and that is another skeletal illness. The next one is called osteoporosis. Remember I told you osteo means bone. It's a Latin name for bone. So it means porous bones. So bones have lost minerals, especially calcium, making them weak, brittle, and is susceptible to fractures, where someone can fall down and get hurt and break a bone real easy. A lot of people that get older develop osteoporosis. Okay, it's good to take your vitamins, vitamin D, which helps your bones. Start taking that on a daily basis. I actually take something like that because I don't get enough calcium in my diet. So I do take a vitamin D specific vitamin for that to help build that because I don't drink a lot of milk. So drink your milk. That is one that helps with your calcium and your bones. So most common places with fractures occur are in your back and hips and wrists for osteoporosis there. Okay. All right, so that is another illness within the bone structure. All right. The next one I'm going to talk about is one, it's kind of rare, but it does happen. It's called scoliosis. Maybe you've heard of that one there too. All right, we got Veryl. Thank you for checking in. Hi, Veryl. If you have any questions, we're talking about skeletal parts of the, I just went over the reviewed parts of the skeletal system and went over the specific bones. Now I'm talking about the illnesses and diseases related to the skeletal system. All right, so scoliosis is an abnormal curvature of the spine. All right, one or more abnormal spine. So your spine kind of curves. It looks like a really, like people are kind of hunched over with this. You might recognize somebody if you see someone kind of really hunched over or their back, they walk kind of differently. All right, it's more girls than boys have severe scoliosis. So it occurs more in girls than boys, but scoliosis is that curvature of the spine. Okay, and it's the spine is kind of has like a S turn to it. They're already shaped like an S, but it kind of the mid part, like the thoracic area, kind of shifts off. Okay, of that spine. All right, so that's the next one here. The next illness I'm going to talk about is one that I actually have, and it's called gout. All right, you might have heard of gout before, you may have not. But what gout is a form of rheumatoid arthritis. Okay, and it results in an overload of uric acid in the body. Okay, so what uric acid is are your purines, your proteins that you eat. So over time, if you eat a lot of rich foods and that are fatty foods, kind of like protein and steak and stuff like that, that could lead to an attack with what they call a gout attack. So this leads to the formation of crystals that will actually deposit in your joints. Okay, and crystals in these joints causes reoccurring attacks of joint inflammation or arthritis. So chronic gout can cause joint destruction decreased kidney function and kidney stones. So I actually take medicine. To be honest, over the years, I had some really bad what they call gout attacks with my feet. They would it would your big toe would swell up. The attack would usually occur in your foot. You know, your toe will swell completely up. It's very hard to put a shoe on. It's even very hard to walk. I've had some of these attacks when I was in my early 30s, and they were just extremely painful, and I didn't know what was going on, so I went to go see a doctor. I had about 5 of these attacks within a 3-year period, and I was limping around when I had these attacks, but I'm on a medication for it. So it's a form of rheumatoid arthritis, and it deals with the diet, and it's also hereditary. So my grandfather had it, so it was kind of passed on to my genes as well too. So again, that's one another type of illness relating to the system here, to the skeletal system. And like I said, this usually attacks around your big toe. Like I said, my big toe was swollen up, couldn't put a shoe on. I was limping around. I even had a cane. It was pretty bad until I got onto a medication or a pill for it, and then it became a lot better. All right, another illness I'm going to talk about is one called spina bifida. You might have heard of that one there too. Spina bifida is a birth defect that involves incomplete development of the spinal cord or its coverings. So the spina bifida literally means split or open spine, and the condition is detected before a baby is born, and it needs to be treated right away for that one. So it's a split part of the spine for spina bifida. So it's another one. It's usually in the lower part of the back there. Okay. All right, so only a couple other illnesses related to the skeletal system, and the next one I was talking about, this kind of goes with the circulatory system that we talked about, is myeloma. And myeloma, we talked about that in the last unit on the skeleton or on the circulatory system. It's a cancer in which abnormal cells collect in the bone marrow and form tumors. Okay, in your bone marrow, which is the marrow within the bone itself. Okay, so multiple myeloma is a blood illness. I mentioned that one last week as well, and one called leukemia as well. So that's a cancer of the blood cells. This also deals with the skeletal system. So it starts in the bone marrow, where the blood cells are, and the bone marrow starts to make a lot of abnormal white blood cells called leukemia cells. So leukemia cells do not work if there's white blood cells, and they stop growing when they should. So that's leukemia there too. All right, so that's everything on the illnesses that I wanted to talk about there. So I covered the everything on the skeletal system, the reviewed parts of the skeletal system with you, and the bones. Your project is due Friday, and if you don't know, I put it on Teams. So I'm going to read it to you real quick so you have an idea, just to make this kind of easier for you. And if you have any questions, I'll turn it over to you, and maybe we'll review a few things that I talked about today here. Okay, the skeletal system project is due Friday, May 1st, along with Brain Pop. Don't forget, Brain Pop's due Friday. There was one on that was just labeled skeleton. All right, you were to pick either the upper or lower torso of the human skeleton. So the upper regions include the hip bone, the upper regions include above hip bone or the pelvis, and include bones and include these bones in your diagram. Okay, with describing the functions of that bone. Okay, so talk about that bone, what it does, what it protects, how it works. Okay, kind of went over some of those today. The upper regions include the ribs, sternum, the radius, ulna, humerus, vertebral column, scapula, clavicle, hyoid, cranium, skull, carpal, and metacarpals. The lower regions include the coccyx or pelvis, anything below, the femur, patella, tibia, fibula, tarsals, metatarsals, and phalanges. Okay, so you could separate however you want to do the upper or lower regions. You don't have to do both. You don't have to do the entire skeleton. Pick an area. Again, diagram it. Tell me what they do, how they function, of each one of those parts. There's probably about at least 8 to 10 different vocabulary that follow each one of those there. But don't forget, the Brain Pop is also due on Friday too, in a 10-question quiz. So the vocabulary part, make sure you watch the video first, then do the vocabulary. Then I'd go back and do the quiz itself for Brain Pop. All right, along with getting this project turned in with labeling and diagramming the skeletal system. Okay. Any questions? Hayden, do you have any questions? Looks like you just checked in. Faith just checked in. Thanks for stopping in. Projects due Friday. Okay. All right, Hayden, do you have any questions? I don't need any emojis here at the moment. I'm asking for questions pertaining to the skeletal system. Okay. Projects due Friday. Okay. Let's go over a couple things on types of joints. Okay, we went over the joints in the human body system, so let's talk about those at the moment here. So there were a joint is where two places is where two bones come together. So they call it articulation or a joint. So there were three types of joints. I don't know if you remember them from Friday, from Monday. Do you remember the names of those types of joints? Anybody could write your answers down on that. There are three types of joints. I don't know if you remember any of these types of joints and what they're called. Okay, elbow. All right, there is a joint within the elbow there. Yeah, that's very good. They call that a hinge joint. Very good. All right, that was a hinge joint. So that's a freely movable joint. That's a synovial joint would be the name for that. So the hinge joint would be one at the elbow, and same with at the knees, where it will extend and retract. Okay, just like a door hinge would. Okay, when you open and close a door. All right, the other type of joints are called fibrous joints or immovable joints, meaning that they connect bones, but there's no movement. Your skull and your pelvis are fibrous joints or immovable joints. Then you got ones called slightly movable joints, which are your cartilaginous joints. So these are bones that attach by cartilage with little movement of your spine and your ribs would be considered there. Okay. Okay. So then there was, like I was mentioning, the hinge joint. Okay, I don't know if you remember this one. I talked about this one on Monday too. Um, this is a type of joint that allows radial movement in almost any direction. It's found in your hip and your shoulders. Kind of rotates like a doorknob in a way. If you throw a baseball, I mentioned that one on Monday as well. I don't know if you remember that type of joint. What that's called. And so it moves almost in any direction. Your hips and shoulders would be considered this type of joint. Okay, this is a joint found in your hips and your shoulders. All right, looks like Val tried to answer that. I'm not too sure what she meant by glenumeral. I'm not sure what that even is. If you want to retype that, Val. Okay. All right, that's fine. You can retry that if you want. Okay, so it's a radial movement almost in any direction, your hips and shoulders, especially for walking and running or throwing a baseball would be an example for that there too. This one in your shoulder, kind of like we're able to turn it all the way around. If you remember that, it looks like a doorknob because it kind of has that rotation where you can move your arm all the way in a circle like fashion. All right. Well, that one's called, yeah, very good. Socket. You're right on top of it. It's called a ball and socket. So I'll put that up here so you see that one there too. Ball and socket. There you go. So that's what that is. So good job there, Val. All right, ball and socket joint for that joint. All right, this type of joint. It slides past one another, like your hands and your feet, like your wrist. What was that called? They slide past one another. So it's usually in your mid-carpal or mid-tarsal, like your wrist or your ankle, around your feet. Do you remember what that kind of joint is called? And whenever that one on Monday there too. Okay, you want to try that? Anyone want to take a guess at that type of joint? We're talking about joints here between the bone. Okay, this one slides past one another. Okay, in your mid-carpal or mid-tarsal area, they slide past your hands and your feet. You remember what that's called? There's a specific name for that type of joint. Very good. Oh no, hinge. That was the first one I went over. That's your elbow. Now that's the one your elbow moves back and forth. All right, that's the hinge joint. Okay. All right, this one is called a gliding joint. Okay, gliding or sliding joint. That would be your hands or your wrists um, or your ankles. I'm putting that up here. Gliding or sliding. Okay. All right, one more type of joint. See if you remember this one from Monday. This is a review as well too. This type of joint occurs when the touching of surfaces of two bones have both concave and convex regions within the shapes of two bones, complementing one another and allowing a wide range of movement. All right, your thumb would be this one. It has a wide range of movement. Doesn't go all the way around like the ball and socket does. All right, but it complements those joints around it. So you're able to move that thumb all the way around. So the thumb, you remember what kind of joint that would be considered as? There was a specific name for that type of joint. Okay. All right. So Chris writes, why can't you move your other fingers around like your thumb? Yeah, your thumb is not really considered a finger. So your thumb is has more use for other reasons. So for grabbing and grasping things. Okay. So it helps us hold things in place. So it does have more range of motion than our fingers do. Okay. So thumbs have a specific type of movement to it, so we can use it for multiple purposes. But there's a certain joint that gives us the ability to move that thumb around. I don't know if you remember the name of what this joint is actually called. All right, that's a good try. Interphalangeal, because phalangeal means fingers, but this one was called a saddle joint. Okay, so went over the types of joints, the main types of joints. These are the movable types of joints: saddle joint, gliding or sliding joint, like your wrists or your hands, wrists or ankles; hinge, which was like your elbow and your knees; and then ball and socket, which is like your shoulder and your arms when you're throwing a baseball or running with your pelvic area, like for your legs. Okay. All right, yeah, that's good. You probably do remember we talked about it, just so I give you a specific word for it. Very good. Okay. Any other questions that you guys may have on the skeleton, axial skeleton, appendicular skeleton? What do they actually consist of? Um, Types of bones, shapes of bones. Okay. Remember the protection, what they're used for, functions of bones. Those are just some basics about this unit on the skeletal system. All right. So skull, spinal column, ribs, those are known as the axial skeleton. Your limbs in your girdle, okay, are known as your appendicular skeleton. Okay. But for the project here, you're doing the upper or lower region. So you get to pick upper or lower, making it easier for you to split them apart that way. Any other questions, Val, Chris, since you guys are on here? I don't know if Soraya or Veryl's still here, or Hayden. Okay. Okay, Val says, what's inside your bones? Very good. That is a good question because that is where bone marrow is stored. It's where we get our blood cell formation. That's what's inside our bone is bone marrow. And that's where there's the outer part of the bone is what they call compact bone. That's the harder parts. The inner parts are spongy bones, which have many open places. And between that is it's filled with bone marrow, and that's where we get the formation of blood cells. Like I was saying, some of those illnesses, and we store fats and minerals within the bones itself there too. Where you need like calcium to help grow these bones. If you have less calcium, you get develop like osteoporosis or your blood cell formation not be correct, or you might have cancer in the blood within that area. So those are good questions. So yes, bone marrow is in between there. Okay, Hayden, do you have any questions? Looks like you just checked in. All right, another question here from Val. All right, for this project, do we need to write life expected medic? No, you don't have to do anything on the disease end on this project, Val. Okay, you are just labeling the parts of the bones and the upper or lower areas and describing those bones and telling me what they do. Okay. All right, what about between your skin and your bones is what Chris has a question. I don't know what you mean by that area. That there's areas that we'll talk about the integumentary system, which is your skin around the body that keeps us protects us. So then between there is the bone, and then your circulation, your veins. So that's what your veins and arteries all run between there. So that's what's between there. So we studied that in the last unit or last week. Okay, so it's between. So it really goes your skin, your blood vessels and muscles and veins kind of run in there. We didn't do the muscular system too, so there, and then nervous system and nerves. So those will all be in between there and around where the bones are at too. Okay, Val, your question here. Can we print out a picture of the skeleton and label it? Yeah, as long as it's not already labeled. Yeah, you could print out one if you find it. Remember, you don't have to do the entire skeleton, just the upper or lower regions. Highlight those areas and tell me what those bones do. So label the bones, just don't label them, but also provide me a definition on what that bone does. Okay, like the humerus, it does this, or it connects to where? What is it? It might be part of a certain joint. Okay, the ones that we went over. Okay, same with the femur, longest leg in the body, connects between your pelvic region and your kneecap. Okay, or your patella. Okay, so use the scientific terms. Okay, got that? Same with you, Chris. All right, I answered both your questions there. Good job. Do we need to color specifics, color and specific bones for something? No, but if you want it, that adds to your grade there a little bit. If you put some time into it, you could color it. Okay. You could keep it the way it is. You don't have to color it. It's not like the last one we did, the blue and the red. For the last one to show you to understand where the blood was flowing in and out of the heart. So no, you don't have to do coloration, but it does look nice if you want to add color to it. But it could be just a picture of the bones of the body, the skeleton, with those parts labeled and defining those definitions to me. Okay, but if you want to color it, makes it look neat. Okay, and you don't have to go over the life expectancy or the types of diseases. I just covered a few of them. I'm not having you do the disease part of on this one like we did the last one there. So I'm just cutting you guys a little break on that part. So just as long as you listen to some of the ones I talked about today, that helps out with it too. Okay. Yes, I did get your last project. Nice job, Val. So thank you for asking. Yes, I did get your project. Yep. I don't know if I put them in a computer yet for that one, so I'm still putting in certain grades right now too. So, but yeah, just keep updating or taking a look at it. Any other questions, comments, concerns about the skeletal system since we're learning about that this week? And the brain pop too. Don't forget about the brain pop. That's also included as a grade too. Okay, that's fine. You can do the bottom portion of the skeleton. That works just fine. Yep, absolutely. All right, any other questions before I wrap up for today on here? So project due Friday. That's how we've been doing it for the rest of the weeks here. Start something on Monday, introduce a new topic, talk about it, give you an idea of a project. Usually everything's due by Friday, so it gives you the rest of the week to work on it, whether it's brain pop, whether it's project with it. Usually I try to do two things for you guys for the week. Okay, along with interacting with me, asking questions as I talk about different parts here. All right, looks like Val asked, do we need to label the types of joints on the skeleton like the gliding joints? That would be nice. That would actually increase your grades. I didn't state that in there, but that would be good because it shows you've been paying attention there too. So yeah, that would be great if you want to add the joints there. Um, Especially like the ones that are in that area. Okay, like you could say ball and socket for the leg, for the femur. You could also say gliding for the feet there too. Okay, so those would fit right perfectly in that area. So there are really only two, and then really three with the hinge joint too. So the free movable joints, the synovial joints, you could include that in there too. That would be nice. Yeah. So those three joints you could write in there too. Gliding, ball and socket, and what was the other one? Hinge. All right. Okay, yeah, just go on to Brain Pop whenever you get a chance to do that. So log in through Clever Val and do that. Um, yeah, that'll help increase the grade if you add parts of the joints in there too. But then, yeah, don't forget about doing the Brain Pop there as well. Okay. Okay, Chris, your question, where can we like write our projects on? You could just do it on paper. You could do it on a Word document, Google Doc. You could do it on piece of paper. You could always screenshot it. You could draw it on paper. You could do it on a Word document. All right. You could do it on poster, but again, make sure you take a picture of it that way. Okay. You could do it on poster, but you don't need a whole big piece of poster board for it. If we did the whole human skeleton, yeah, if we were in a classroom and stuff doing it like that, we could have done it that way. But um, no, just do it on just do it on paper or a Google Doc. But if you have a poster, that's fine. I'm flexible either way, however you want to do it, as long as you send it to me. All right, any other questions here before I sign off? Okay, you could do it on a computer. Yep, absolutely, Val. Good job. Okay. All right. Well, I'm going to sign off because there's just under 5 minutes remaining. But if you need any more assistance or help, I'll be back on at 1 o'clock today. So you could check in with me if you need to have any other last minute questions. I'll be talking about similar stuff that I just talked about today, and some other students check in at different times. So I'll be available then. So check in with me there if you have any more questions, or email me or message me on Teams about anything that you may have before Friday. Okay. All right. I'm signing off for right now. So have a good day. I'll talk to you guys later. Goodbye.